Bello Body Lift goes a step beyond the traditional tummy tuck. It was developed by Dr. Chiaramonte to meet the needs of those who desired a more contoured midsection. His pioneering surgical procedure removes excess skin and fat from below the breast area through the entire front and back of the midsection.
I found so many patients after they had a tummy tuck were somewhat disappointed in the results because their whole midsection wasn't very well contoured. Usually those patients would have to come back 3 months later to undergo liposuction. That would require a second operation, more time off from work, a greater expense to patients. So what I developed was a single operation that accomplishes those goals at one time. I combine liposuction of the entire midsection with a tummy tuck that gives a patient a very dramatic result in one operation.
How do you decide who's a great candidate for a tummy tuck and who's a great candidate for a Bello Body Lift?
In general, smaller patients that have just excess skin are great candidates for tummy tucks. In general, they're a dress size, 2 through 6. Maybe they only need a little liposuction on the hips. Patients that are a dress size 8 through an 18 or even a 20 are great candidates for the Bello Body Lift because they get their entire midsection contoured at the same time all the excess skin is tightened. This leads to a very dramatic result with a single operation, which is the Bello Body Lift.
Tell me about your experience with Dr. Chiaramonte.
It was great. I had always wanted to do some sort of plastic surgery because, growing up I was an overweight kid, lost a lot of weight, had loose skin, so I needed to get rid of it. Always felt uncomfortable. So I went to another consultation. They told me they would have to do 2 procedures to do what I needed to have done. So then my wife had a consultation with Dr. Chiaramonte, brought me back information, and I decided that he offered the best solution for me.